Hello, everyone. My name is Dr. Patricia Jeudin. I am a representative of the African Caribbean Cancer Consortium. I have no financial disclosures. So AC3 was established in 2006 and comprises of over 30 institutions across the globe. And our mission is to understand all of the factors affecting cancer outcomes in populations of African descent. And we want to use this information to help mitigate these disparities. As I mentioned, we are a global network across 16 countries in the Caribbean, 4 countries in Africa, and across 12 states from coast to coast. Our leadership is divided by site and country and comprises of researchers, cancer advocates, and oncologists. We're also divided into 3 committees, and our working group leaders are further divided into site-specific cancer groups. The Women Cancer Group focuses on breast cancer, cervical cancer, ovarian cancer, as well as other GYN-related cancers. And some of what we looked at is HPV in the African Diaspora. And so in one study, we looked at HPV prevalence in the Caribbean versus in the United States and found that women in Jamaica had the highest prevalence of HPV infections in comparison to women in Tobago and white women here in the United States. Next, we looked at the HPV genotype distribution and found that high-risk genotype most prevalent in the Caribbean population, that is Tobago and Jamaica, was HPV 45, whereas HPV 33 was most prevalent in the United States. And though not statistically significant, HPV 16 and 18 was most prevalent in the Caribbean as opposed to the United States. We also looked at the most common HPV subtypes by country, and this is both high-risk HPV genotypes and low-risk HPV genotypes across 6 different countries in the Caribbean and in Africa, and found that there was wide variation of the most common HPV subtypes in those regions. We then looked at the proportion of HPV infections covered by current non-valent vaccine by country and found that countries in Africa had the lowest coverage of high-risk HPV infection as opposed to those in the Caribbean. Also, there was very low coverage of low-risk HPV genotypes in the majority of locations. Other publications have looked at attitudes towards HPV in the Bahamas, and also the distinction between high-risk HPV genotypes in the Caribbean versus those in North America and in Europe. Also here in America, we've looked at the knowledge of HPV and the human papillomavirus vaccination between Black women and white women. And participants of African descent were less aware of HPV than whites, and also were less informed of the HPV vaccination, and that HPV was a causative agent of cervical cancer. And although the majority of women in this cohort had heard of the vaccine and had heard of HPV, the proportion of women who were Black who had heard of the vaccine were less than those who were white. Also, looking at vaccine acceptability among US-born and immigrant Hispanics and US-born and immigrant non-Hispanic Blacks, the overall acceptability of vaccination was low in all groups. Black and Latina immigrants were less likely to know where they could get vaccinated and reported more concerns of cost. US-born non-Hispanic Blacks were least likely to endorse HPV vaccine safety. Although many of our studies are conducted overseas, the importance and relevance to us here in America is that the Black immigrant population has increased significantly since the 1980s, with the majority of immigrants coming from the Caribbean and from Africa. Also, historically, all Black individuals generally were categorized as African Americans in research. However, there are unique and important differences among each ethnic group. And these key differences are in social behaviors, health practices, beliefs, as well as language proficiency, all of which affect health outcomes. So our goal is to continue our transdisciplinary research. We look at different health systems, we look at epidemiology, biological and behavioral research, and see how this information can affect interventions and also health policy changes that will ultimately increase cervical cancer screening and HPV vaccination in these populations to eradicate cervical cancer. Our future directions is to expand our collaboration across the globe, improve our collaboration for funding, and also continue advocacy and community engagement. Thank you for your attention today.